We continue our Roe v. Wade coverage with a professor of health sciences and obstetrics and gynecology from UW-Madison. Tiffany Green, welcome to Live at 4.
Thank you for having me.
Very first, I want to ask, what is the ripple effect for women's access to health care now?
I think people with the capacity to get pregnant are going to suffer quite a bit of fallout from this decision. In our own state of Wisconsin, Planned Parenthood and other independent clinics are now not providing abortions. In fact, the only abortions allowable under the law are those that place the pregnant person's life in danger. So that's where we are right now in our own state of Wisconsin.
Yeah. And so for people who are pregnant, who maybe they're starting the steps for this type of health care, paperwork and logistics and whatnot, does this provide a gray area for them?
Right now, I think health systems and others are probably thinking through the legalities right now, but as of now, no one is offering this service in the state.
How do health systems adapt to this, and will there be a type of burden in doing so?
And I want to emphasize that I'm speaking for myself here, not speaking for UW Health or the School of Medicine. My impression is that, again, lots of legal teams and other decision makers are thinking through the implications and what to do moving forward. Everything is really up in the air right now.
And reaching this day, 50 years of a precedent overturned, is this sort of a culmination of how states have limited or restricted abortion over the years?
That's a really great point. I think a lot of people sort of think about this as, well, this one-time decision, but states really have been chipping away at Roe v. Wade for quite a long time. It could be anything from mandatory waiting periods, like imposing 24, 48, and in some cases, 72-hour waiting periods for abortions, instituting mandatory counseling requirements, imposing regulations on abortion providers in terms of clinic setup that they don't do for other outpatient ambulatory procedures. It goes on and on. And because of those regulations, clinics have had to close. And it's been more and more difficult for people to access abortion in the first place. So while this decision is quite far-reaching, it is something that has precedent. And it's the way that it's been shipped at and rolled back over the past several decades.
I've seen a lot of conversation online. Do you foresee this affecting how miscarriages are treated, or IVF, things like contraception? Can we predict any outcome from that?
Oh, I absolutely do. We could see from Justice Thomas's Justice Thomas's opinion that other things like gay marriage should be revisited. It's I think that there are going to be a lot of implications and fallout to this decision. In terms of miscarriages, I think an important point is that there are already people that have been prosecuted for miscarriages, particularly disproportionately people of color, right? So this is not anything new, and I think this is going to escalate given the legal environment that we're in now. And importantly, I want to say that Black people are more likely to have miscarriages in the first place, right? So we have a situation where people of color are going to be disproportionately targeted, as they have been in the past, regardless of whether they were trying to self-induce an abortion or not.
And we have a few more seconds, and to further emphasize that point, so do you predict that this will affect people of color and also affect people who have lower incomes and maybe people in the more rural parts of states?
100%. There are people in the northern part of Wisconsin that ostensibly we're in a post-Roe world for a very long time. It will affect the disadvantage, whether it comes to SES and/or race, disability, gender. All of those things are going to matter in terms of historically excluded groups being disproportionately affected.
Thank you so much for giving us this insight and joining us today.
You're very welcome.